The benefits of exercise for people living with and beyond a cancer diagnosis are well established. A wide range of types and intensities of exercise have been shown to improve quality of life and potentially may even extend life. The compelling evidence base demonstrating the benefit of exercise for cancer survivors led to both Exercise and Sport Science Australia and the Clinical Oncology Society of Australia calling for exercise to be embedded as standardised care for people with cancer. Exercise is widely accepted as safe, with very few absolute contraindications to participation, even for people living with or beyond cancer. However, the reality is that we have very limited evidence supporting the safety of exercise. Every healthcare intervention is associated with a risk of harmful or undesirable events, and we determine the appropriateness of an intervention for a population or individual by balancing the benefits against the harms. There has been growing recognition across clinical trial disciplines of the need to provide balanced reporting of benefits and harms. This is evidenced by the Consort Guidelines and Consort Harms extension. However, guidelines originally devised for pharmacological trials are not appropriate for application to exercise trials without modification. As such, the Exercise Harms Reporting Method, or ExHaRM, was specifically designed for harms assessment within exercise oncology trials, but may also be applicable for use in other behaviour change settings. Harms are the totality of possible adverse consequences of an intervention or therapy. They are the direct opposite of benefits against which they must be compared. In the context of exercise as an intervention, adverse events, which only include medical occurrences, is not a comprehensive term to capture all harms. A more appropriate definition of the harms of exercise is all undesirable physical, psychological, economic, or social consequences that are related to an individual's participation in exercise. Data regarding the harms of exercise are required to allow clinicians to judge the safety profile of exercise as a potential adjuvant therapy, to allow patients to make informed decisions about potential consequences of exercise participation, and to allow exercise professionals to determine the appropriateness of exercise. ExHaRM is a protocol that was developed, trialled and refined by the IHOP research group to guide comprehensive, reliable and informative harms assessment and reporting in both research and practice. ExHaRM involves 4 core steps to capture, classify, analyse and report all-cause and exercise-related adverse outcomes. Step 1. Monitor occurrence of adverse outcomes through systematic and non-systematic surveillance. While not part of harms reporting process, the exercise professional has a duty of care to the participant to identify, consider and manage all adverse outcomes as they occur. Step 2. Assess and record adverse outcomes, including severity or grade, causality or the likelihood of a relationship with exercise, impact on intervention or exercise participation, and type of adverse outcome. Step 3. Review of causality for quality assurance and harms management. Step 4. Analyse and report frequencies, rates, and clinically meaningful details of adverse outcomes. This 4-step process provides a framework for the collection, classification, analysis, and reporting of adverse outcomes. ExHaRM was developed with the goal of improving the quality of harms assessment and reporting within exercise oncology research and practice, but also has potential for application to other behaviour change therapies. The full report on ExHaRM is now available in BMJ Open.